Hello and welcome back. Doctors of Ignite Chiropractic here, and we are talking about the symptom of the month, which is carpal tunnel. Going across all the commonly asked questions of what it is, how does it happen, what are things to do about it. Well, we here at Ignite Chiropractic are here to talk about it and give you some answers. I'm going to go ahead and kick it off by describing and talking about what carpal tunnel syndrome actually is. Carpal tunnel, well, I like to break it down. So carpals meaning the bones within your wrist right here. So that's the first part, meaning something is irritated there. Tunnel, because there's actually an opening within the carpal region in the wrist right there where there's the vessels and nerves that come out of that area right there. And whenever that carpal tunnel area gets compromised or gets compressed, it will start to have symptoms like pain. There could be numbness and tingling going into the fingers. Could be feeling a falling asleep sensation. You can have loss of coloring in your fingers. There's lots of varieties of different symptoms that come up, but people label that as carpal tunnel syndrome. So knowing that now, Dr. Lee, what are some of the causes of carpal tunnel syndrome?
So we know carpal tunnel is actually in the wrist right here, and what it's doing is it's opening up a space, like you were saying, Dr. Nat, to allow the nerves as well as some of the blood vessels to pass through that. And when that starts to collapse, and you now have a smaller space, it's literally it's a compression type of an injury. So it's a compression problem where the nerve that goes from the neck that travels all the way down the arm, it goes into the hand, and when that nerve starts to become compressed, then it starts to give people pain, numbness, tingling, and weakness that starts to go into the hand. And so that's what the major cause is, that compression. Now, the cause that most people aren't recognizing, though, is that you can actually have what's called a double crush syndrome. And a double crush, it means that if you think about it being a hose, if you were to step on a hose, the water's obviously not going to get out of the hose. But if you step on it just slightly in one area and then slightly in another area, well, now you might have the same amount of loss of water flow as if you stepped on it completely on one side. And so that's what's happening in the nerves. The nerves connect or come out of the neck, sending messages from the brain down through the arm into the hand. And if you have a slight compression at the neck, where those nerves are irritated up at the neck, or anywhere other down the arm and other impingement sites, you can have a compression here, 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 or here that also mimics and exacerbates the carpal tunnel symptoms. And actually that's what we see more often than we actually just see of the carpal tunnel itself, is we'll see multiple compression sites, most commonly in the neck, that are actually causing issues that are showing up in the hand, creating carpal tunnel syndrome. So we have to address that at the neck in order to correct it. Yeah. And so I know I touched on it a little bit, but what are the symptoms, Dr. Chris, of carpal tunnel syndrome?
Some of the most common symptoms that we see in the clinic here is things like pain. And like you said, it travels all the way down, but mainly they'll talk about their pain in the wrist. Sometimes it travels up, sometimes it goes down into the fingertips. But the most common presentation is that pain goes into the fingers, into the palm, half of the middle finger, the first digit, and the thumb. But that can also be pain, numbness, tingling, burning, muscle weakness, like you were saying as well, that grip strength starts to diminish. People start to feel like they're clumsy, like they're dropping things all the time. So just normal daily activities get diminished as you start to see that flare up a lot more. So speaking of that, whenever we go to check on how these nerves are firing and how is this functioning, Dr. Sean, how would we go about diagnosing carpal tunnel syndrome?
Yeah, great question. So as you mentioned, one of the things that we could do is a history of symptoms, looking at how's the function of these three. Is there any sensory loss, muscle weakness, numbness, tingling, things like that. And then you can actually do a physical exam that'll go in and test to see, is there any loss of feeling? Is there any weakness associated with those areas? We could also take x-rays of the wrist to rule out like arthritis or a fracture. As Dr. Lee mentioned, we like to look for double crush syndromes as well. So taking x-rays of the neck, possibly shoulder or elbow if it warrants it, can give us extra information about that as well. Other tests that may be done could be an ultrasound to see if there's an actual compression of the nerve. Electromyography, where they actually put needles into the muscles to test the activity of the muscles to see if there's a muscle problem that might be mimicking carpal tunnel, is another method. And then the gold standard, which I recommend if anybody's considering surgery, make sure you get a nerve conduction velocity test before that. It's where they actually put needles in the nerves all the way from the neck down. They should be testing the nerves from the neck all the way down to the wrist to see where there is actually compression. And if they do it appropriately, they'll find out if it's just in the carpal tunnel or if it's coming up from the elbow and so forth. The majority of these cases can be managed conservatively by doing the physical exam, the history, and including some x-rays like we do in our office here.
So actually, to piggyback off of that, it's not very common to actually do an NCV, a nerve conduction and velocity study test, at multiple sites. Usually it's just done at one site. Can you comment on that?
Yeah, absolutely. So they may just do down at the wrist, and if they see some compression there, they'll say, oh, there it is. But as you mentioned, you could actually have multiple compression sites that are all contributing to that, and you may only get partial relief with that. I've even actually had a colleague or mentor of mine, he used to do a ton of these tests, and he had a patient that was scheduled for a carpal tunnel surgery, and he went and did one of these tests, found out that the nerve that's supposed to go through the carpal tunnel, there was an anatomical variation. It didn't even go through there. It went through a much smaller canal where another nerve goes through. They would have done an unnecessary surgery looking to decompress a nerve that wasn't even there. So.
Yeah. Wow. Very
So
powerful.
that brings us on to our next one. And Dr. Natalie, how is carpal tunnel syndrome treated?
Well, there's a variety of ways that it's treated. So I like to do comparisons of how it's typically treated versus how we look at it first in the chiropractic office. So typically, if they are doing nerve conduction velocity tests, or like they're gonna check that, see where it's compressed at, and one of their first things before they find out whether it needs surgical intervention or not, what they'll end up doing is they'll put steroid injections in that region right there. Because it's like, oh, let's just cut the pain as quick as we possibly can. So let's go ahead and put the steroid injection in that area, which the median nerve, which is telling you something is going on there, it's basically just numbing the area so you don't feel the pain anymore. So maybe it gives them a little bit of relief for a little while. And then if it comes back, then they're like, okay, we'll either try those injections again, or at the same time, let's go ahead and use a splint. So it's common for splinting that area right there because you want to keep this wrist or keep that in a neutral position while you're sleeping throughout the day. Heaven forbid if you're like lifting and carrying things, like if you're a waitress or something like that, they'll recommend rest, of course. So rest, splinting the area right there, so that way you can give an opportunity for it to actually heal, let the inflammation go down. Steroid injections, I'm sure they also do some anti-inflammatories or pain relaxers and stuff. Now in the chiropractic world, what we're looking at, more holistic approach, is we are checking the other areas of the body to see, okay, is it directly here in just the wrist? Is it the elbow that can also be irritating the area? Could it be the shoulder? And could it be the neck, of course? So how we treat it is we want to make sure that we get the area adjusted. So we're adjusting the neck to make sure there's not an overflow going down into the carpal tunnel region. Because I'll tell you, 8 times out of 10 when patients are presenting in our office, a lot of the times they'll have bilateral carpal tunnel syndrome. And anytime they're showing up with bilateral carpal tunnel syndrome, it is telling you it's coming from the neck. It does not show up on both sides. We usually are not using both of our hands the same exact way. There is a dominance with one hand over the other. So anytime it shows up bilaterally, that is a sign it is absolutely not just coming from that one region right there. So how would I say that we take care of it is the fact that we do adjustments, we follow through, we take x-rays. Yes, we can adjust anywhere 2 bones come together from the neck. We can adjust the shoulder, adjust the elbow, adjust the carpals individually. Every area looks a little different. And so that way you can make sure you get a holistic approach in taking care of such an issue. So moving on, Dr. Lee, what are the non-surgical treatment options for carpal tunnel syndrome?
So I know you hit a lot of this right now, but the non-surgical treatment options for carpal tunnel is rest. Basically, just leave it alone. Don't stress. Don't use your hand. A lot of times, the inflammation, if it was a short-term, temporary thing, that'll usually knock it out. The other is to splint it, and once again, that's also to kind of relieve the tension and pressure to decrease the inflammation, so that you're not irritating it, which kind of falls in line with the rest idea. Over-the-counter drugs, that's really common. So painkillers, anti-inflammatories, once again, you're kind of just dealing with the symptoms of it. Physical therapy can be good to help to strengthen muscles that have become weak, as well as to stretch out muscles that are overly tight. Cortisone injections is another really common thing. We see a lot of people, it's like when it's been going on for a while, the doc will usually do an injection to try to give the patient some relief. Problem with that is it has a lot of really negative side effects. You can only do it every so often because it actually starts to damage and to deteriorate the tissues and the joints. So that's really not something that you want to do unless you're in a really dire strait. Ultrasound is really common. That's another one that a lot of people will go to, and that's another thing that can help, as well as cold laser. But I kind of hit all of those first. And we see a lot of carpal tunnel, and we don't do any of those things in our office. If we needed to, we would absolutely incorporate that, but 99.9% of the time, just through the chiropractic adjustment alone and taking a holistic approach, addressing the neck, as well as addressing the other joints where that nerve comes through that ultimately goes into the hand, like we've been discussing. If you're able to make sure that those joints are functioning appropriately, starting from the spine, moving out, down into the wrist, then you don't have to do any of the rest of this stuff. You don't have to take meds. Obviously, rest is helpful no matter what, but you won't have to do any other type of therapy because most people can get relief and a sustainable solution through chiropractic care. Now, this is actually a really common question that we get is, what's the recovery process? Dr. Chris, I'm gonna kick this to you. What's the recovery process after carpal tunnel surgery look like?
So, great question, because we have a lot of patients that go and get the surgery and then they're still in recovery or they don't have any relief from the symptoms anyways. So, one, it depends on how the surgery went. You know, if they got the surgery and there were complications and they nicked an artery or they nicked a nerve where the nerve is no longer firing, so they have permanent damage, that's going to be a lot longer recovery and on how they feel for the rest of their life. But if they damage blood vessels, if they started developing scar tissue because of how they had to open them, there's a lot of different complications that can happen. Most common is anywhere from weeks to months, but if there's more complications, it can take months to years. So it really, really depends, and that's coming from Johns Hopkins Journal, and that's what they talk about on their surgery website. But also, like I said, if they start to develop scar tissues, that's something that's going to create actual carpal tunnel later on in life, because now it's starting to develop tissues around that nerve that's going to start putting compression on it and actually start causing true carpal tunnel. So it's one of those catch-22s. It might help, but there's also the fact that it can start to cause the true symptoms later on in life. So that, and then the risk for bleeding and infection is also very big during this time. Now that you have an open wound that's more susceptible to be getting things like infections, prolonged bleeding later on in life. What was the other one that we had in here? And then recovery times. So they're going to also recommend physical therapy or some type of conservative care. If you're getting a good doctor who's paying attention and doing nerve velocity tests like you were saying, but also recommending conservative care beforehand, more of the time your recovery times, if you have to still get the surgery, are much less if you did the conservative care beforehand.
A lot of times you don't even have to, you go through the preparation, the physical therapy preparation or the chiropractic care preparation or both, and by the time the surgery date comes around, like the problem's gone.
Exactly.
Yeah, and so it's a must, in my opinion, that people try something conservative first before they jump to surgery, and make sure that they're incorporating chiropractic and physical therapy, or chiropractic then physical therapy, before they just jump right into surgery and only try one of them.
Yeah.
Right.
Which actually leads us to the next question: how long does it take to recover from carpal tunnel syndrome? So, Dr. Sean.
Yeah, so if you do nothing, it's possible that you don't recover from it, because usually what is happening is there's a repetitive motion or something that the person's doing that keeps flaring up and triggering this carpal tunnel. If they're able to identify it and give it a rest, as Dr. Lee was mentioning earlier, you're going to recover, things are going to calm down, a couple weeks, things should be doing better. But most people don't. They keep typing away at the keyboard, or if they're wrenching away at things like that, it's going to continue to flare up that carpal tunnel, or they just might not be able to lay off of that activity because that's how they make their income, and it's going to keep flaring it up, and it could be a long, long, long time for them to recover. As Dr. Chris mentioned, the surgical options, it could typically be 2 weeks if everything goes well, but after all the complications, you could get a return of it. It could become permanent damage from scar tissue and blood vessels, and you may never recover in that sense from carpal tunnel. And then classically, they may just splint it, and it's kind of 50-50 if you recover from using a splint, and that usually is a few weeks to a couple months. What we see with care in our clinic, usually people are getting relief within a few weeks, especially because we're addressing that whole kinetic chain from the neck all the way down. You may be having compression at the joints, you may be having abnormal function of muscles along that way that could be entrapping and compressing on the nerve, And because we look at that whole system from the neck all the way down to the fingers, we start seeing relief pretty quickly within a couple of weeks, usually fully resolved within a month or two. And they maintain that, and it rarely comes back. So, that's going to bring us to the next one. And Dr. Natalie, what are some of the potential complications of carpal tunnel syndrome?
Yeah, we have all touched on that as we've been sharing all the other information, but again, a lot of the complications is continued numbness and tingling, continued loss of sensation in your fingertips, continued pain in the area, continued weakness or furthering of the weakness or furthering of the pain or furthering of the loss of sensation in your fingers, and furthering of not able to use your hand the way you once used it before. So those are the potential complications, especially when you do nothing about it. Those also can be complications or potential complications from having an inaccurate surgery, having a surgery whenever you didn't need surgery on it to begin with, because it really actually wasn't carpal tunnel syndrome. It was showing up as symptoms like that actually from the fact that there was issues in the neck, and then also issues leading into the shoulder, down into the elbow, down into the finger. So a lot of those complications come from the fact of either not doing anything, which is a choice for some people, of just utilizing maybe splinting, which was a decision like, I'm going to be conservative by splinting it. But again, you're essentially not doing anything. You're just putting a splint on it during the time to try to function. And then the other complications, if you do have an unnecessary surgery or a surgery that goes wrong, creating scar tissue, addressing it the wrong way, other areas being nicked or messed with at the same time. Those are those complications that can lead into permanent things. And again, I just have to share, as all of us have said, there have been so many patients that have come into the office, already have had carpal tunnel surgery, right? And they are continuing to wear, and a lot of them are nurses or something where they're doing heavy lifting and a lot of like pulling and these types of, or cleaners or whatever else it might be. And they're coming in with these splints on their wrists when they're coming in to get adjusted. And that was just part of their daily routine. And then after just a couple weeks of addressing not their wrist directly, of addressing their spine, they're no longer having to wear the wrist splint, or they're no longer having to wear the elbow splint as well. And yet they're still working their long hours while on their feet, doing nursing and whatever else it might be. So sharing all those complications, knowing it is always important to go the conservative route first. Of course, we will recommend chiropractic care, and so that way you can actually get it checked and get the appropriate areas addressed. Or also doing some exercises through, PT, but definitely get the nerves checked through chiropractic examinations, right? So that all said, can carpal tunnel syndrome be prevented, Dr. Lee?
So absolutely, carpal tunnel syndrome. Most times people are thinking about prevention. They're thinking about like, oh, I've never had this before. I want to stop it from ever happening. But to be honest, nobody actually thinks about carpal tunnel that way. Like, oh, I want to make sure my wrists stay healthy so I don't get carpal tunnel. It's someone who's had it who cares about it. They want it. Maybe it's gone away and they don't want it to come back. So when we look at prevention, it's more of a repeat event, right? And so that's the way that I look at it. And if you look at how it's actually being created, it's more commonly associated with issues and dysfunction stemming from the lower part of the neck. So and that's kind of a big stretch, because why would it be coming from the neck if it's happening in your hand? That's like way far away from the neck. Well, guess what? The nerves in the neck go into the hand. And so they start here, and if you pinch up here, guess where you're going to start to feel it? If you push hard enough, your whole arm can go numb. If you push just on the right nerves, then what will happen is you'll feel numbness, you can feel achiness and pain, and now you start to create dysfunction. Well, the muscles that control the wrist are coming from where? Well, the muscles that are the nerves that are controlling the muscles in the wrist are coming from where? They're coming from the neck. And so if you have any compromise in how those nerves are communicating to and from the brain, then now the nerves are going to coordinate the muscles wrong. And what that starts to do now is every time that you grab stuff, every time that you're typing on a computer, every time that you're using your hands the way that we are designed to do it, then now you're going to be moving it wrong, and it's actually going to create irritation in the joints, and it's going to create inflammation. And that inflammation there long enough will actually start to cause issues that lead to the inflammatory cascade that actually now will start to irritate and cause carpal tunnel-like syndrome. And so what we want to do is we want to make sure that our spine is correct, that is functioning the way that it's supposed to, and doing other things that can decrease inflammation in the body. So eating a diet that is higher in alkaline foods than it is in acidic foods is going to be very important, because if you have increased acidity, you're going to have increased inflammation in the tissues of the body. So we want to make sure that we're eating more plant-based nutrition in our diet. The more raw foods that we can be getting, the more alkalinity we're bringing in. So the fruits and the vegetables, the nuts and the seeds are going to be able to help the body to decrease that inflammatory load more. So you want to make sure that that is set up so that you're not having carpal tunnel syndrome, amongst many other types of issues that can start showing up in the body. So that's my spiel on prevention. But when we talk about lifestyle changes, Dr. Chris, can you talk about what lifestyle changes could help manage carpal tunnel syndrome?
So you set me up perfect already with it, because you started touching on them. So things like keyboard use, mouse usage, ergonomics, things how you do things at work. You can start to change some of those things if you find that you're looking down and you're in this position all day. Let's open things up. Let's sit up straight at least 2 to 3 times a day, where you're not in a constant 6-hour sitting like a little hunch person in a little creeping hole, right? We got to open things up. We got to get your body open. Get things changed in your work environment so you can actually be more productive in the long run and prevent a lot of these. And then, like you were talking about earlier, Dr. Natalie, you can have a splint as well if that's something that you need temporarily. Hopefully it's not long term, just to help get you through that rough patch as you're still recovering and getting past that. Those lifestyle changes, if you're in that position and you can't change anything just yet, protect yourself as best you can. Give yourself the best opportunity to be able to thrive. You talked about getting your spine adjusted, getting your wrists adjusted, get the whole complex checked. Those are also lifestyle changes that a lot of people don't realize is a lifestyle. As you start getting your body healthy, you start moving, getting your spine checked, getting the muscles firing like they're supposed to. Everything is cohesive in how our body functions. So, and then I wrote down another one, you hit on this one too. Fruits and vegetables is very, very big. So specifically vitamin B6 is what the studies are showing, because it actually helps decrease inflammation. So if you're having inflammation around the wrist because we're having a very acidic diet, if we're getting fruits and vegetables, very raw sources of those vitamin Bs, those can actually help decrease that inflammation, decrease the swelling, get you a lot less inflamed, get you feeling and functioning a lot easier there. So those are just some simple ones that you can add in, but also just conservative rehabs of your own daily life is going to be really beneficial in the long run.
I'd like to add in also water as well. Like the quality of our water matters so much, because it's so crazy, first of all, that we're paying for water, and then the better water, the more expensive the water is, and so the quality of your water does absolutely matter. From if you're just drinking from the tap water, like what's the quality of that, the cyst, the fluorine, or the fluoride, the chlorine, all these other things that get inside the water sources, that can be a whole nother conversation around that, but making sure that you're staying hydrated. Yeah. So if you're not consuming a lot of fruits and vegetables that are hydrating of their own, having a lot of that structured water, so it adds in the proper nutrition, but also the structured water to keep everything hydrated throughout the bones, throughout the tissues and everything else, then really making sure that we're getting alkaline-based water. Of course, if you can get those on the pH level, that's more alkaline water, that's even better as well, and not the fake stuff where they're adding all this extra stuff in there. Water in of itself can have beautiful purification benefits, and obviously hydration and everything, which will help along with lifestyle changes. Yeah. So drinking more water too. Right?
Good point, thank you.
Yeah.
Which, the next thing, part of lifestyle changes, Dr. Sean, what kind of exercises can help alleviate carpal tunnel syndrome?
Yeah, that's a great question. So typically most of the exercises are going to focus around stretches of the wrist. As we talked about earlier, most people consider carpal tunnel to just be coming from the wrist, so let's focus on some of those. Really what you want to do is try to just increase mobility and stretch out through here. So you can just do some rotations of the wrist. Another good one to help open up that joint is just opening and closing the fingers and thumbs like so. We also want to kind of focus on this flexion and extension aspect of this as well. But I'm going to one-up this because we also talked about, a lot of that can be coming from the neck, so don't forget about stretching out the neck. You can do simple bending the head forward and backward to end range motion, and then side to side, especially away from the side of where you're having the carpal tunnel, to really stretch things out. Another exercise that you'll see come up a lot is what are called nerve gliders. It's where you just really put a maximal stretch into the muscle groups that are associated with that nerve. So for example, we're talking about the median nerve. You would want to bend the neck away and then fully open up this arm or palm up and then you would really just stretch things back like that. And I would actually bend my arm back a little bit. Dr. Chris is there though, but that's really just going to stretch all the muscles in that nerve right along that pathway, and you'll kind of flex it back up and back out again. Okay. Just nice and gentle. It shouldn't cause more pain as you're doing it. Just get nice gentle stretches in through there. And yoga is another great one. There are many, many different yoga positions and moves that can actually help realign some of those muscles and ligaments and tendons that could be related to the carpal tunnel, and just really help balance the body as well.
Yeah, so for people who want to learn more about that, if you type into Google, you type in nerve gliding or nerve flossing.
Yep.
So type in that for carpal tunnel and into YouTube, and they'll have good demonstrations of the different variations on how you can do that. So that if one version isn't really cutting it, you can try several others as well. But
yeah, there's quite a few different ones. That was just one example of the nerve gliding. So, and then that's going to bring us back to posture. What are some ergonomic tips that you have for avoiding carpal tunnel, Dr. Natalie?
I love this one because it is something else that people always ask us, and Dr. Chris started talking about this with the ergonomics within lifestyle changes. And people are always asking because so many people work from home now. So many people are working on the computer all the time. So we always like to say, don't you bring yourself to, or like bring the computer or bring the tablet or bring the phone to you, not you to the tablet or the phone or the computer. And what do I mean by saying that? It means that, okay, where are you where you could be feet on the ground, or if you're on an awesome kneeling chair, however you can be, where you're leaning forward and then the arms are at a perpendicular, meaning 90-degree angle where your hands can be typing, versus they're not up like this, or it's cocking your wrist up, and you're not going down like this where you're cocking your wrist down. So you want to make sure your keyboard is situated to where your arms can be at a neutral position and having your wrist in a neutral position while you're typing on that. Similarly, if you were typing on your phone, now notice that if you're typing on your phone in that position, you have to bring the phone up to you. So now there is going to be a limitation as far as how long you could be typing, because you're wanting to avoid the kink in the neck, having our neck always being bent forward. So being aware, if you're bringing the phone up to you, at some point you are going to lose sensation in your fingers because of the fact the blood flow is going to be cut off from bending the elbow right there. So keep that in mind. A lot of times people are not doing a whole bunch of work holding on their phone like this, or hopefully they're not. So setting up the ergonomic station as far as how you're seated on the chair, so you're upright, the head is looking straight ahead. If you need to put books or stack books or something underneath your monitor, so that way you bring your monitor upright so you're looking straight at the monitor, and then your hands are set up in a situation as far as the keyboard and the mouse and whatever else you're using, so that way you keep your wrist in a neutral position there. And then also paying attention to your chair and how's your chair situated. So yes, your shoulders are back. You're not having to be crunched forward, which is awful that there are so many chairs that are comfortable because they force your shoulders in a rounded position. There's so many vehicles in the car, which leads to another thing. Not only are people maybe working in the car a lot, but there's a lot of people at home on the computer a lot. People are in their vehicles a lot as well. So mess with your steering wheel. Where is your steering wheel position, so you can be at the quote 3 o'clock and the 9 o'clock whenever you're holding your steering wheel, or if you're kind of one of those 2 and like 7 o'clock kind of people, or however your positioning is with it. Make sure you're setting your steering wheel in your, or you got the OG lean back, So it's like if you got the OG lean back, make sure your wrist is neutral and your steering wheel is like keeping your wrist neutral like that. But again, messing with your seat in your vehicle, bringing it forward, bringing the seat upright. I know if you want to be cool, you can't exactly have your seat upright like this and feel like grandma, but grandma had something right in the fact that she's actually sitting upright so she can feel very comfortable holding onto the steering wheel while she's driving. So taking all of that into account as far as your posturing, whether you're in the vehicles, wherever you're spending a lot of time. So that way you keep things neutral. You're not cocking your wrist up or down. If you're working in like you are like, a waitress or something like that where you're constantly having your hand like this, there's only so much you could do, with the rest in between time is really what's important as well. So we're talking about ergonomics in that way. And then also, again, not just paying attention to what's happening in the wrist, paying attention to what's happening with your neck as well, because as we know, the neck will absolutely affect what's happening down here. So we want to keep proper neck posturing as well as shoulder posturing, keeping the shoulders nice up and rolled back as much as we can, and then keeping the wrist neutral and the elbow in a neutral alignment as well.
And a big thing when you think about ergonomics is, to try to prevent carpal tunnel, it's the big thought is that if you're in the proper position most of the time, then you're never going to have this issue to begin with. But the problem is most people have bad posture, but most people don't have carpal tunnel syndrome. Most people are not in the ideal ergonomic situation, but they don't have carpal tunnel syndrome. So why is it that some people get it and doing this, doing the same thing that they've been doing for years, and all of a sudden it suddenly pops up on them? That's really because they're now actually dealing with dysfunction in the joints that have been accumulating for a long period of time. So sure, they need to change their ergonomics up to help them through this, and it's going to be better long term. But just doing that often won't fix the issue. They have to actually get it addressed at the spinal level, which we talked about before, because when you take the pressure off the nerves in the neck that control everything down into the arms, it decreases the inflammation, allows the body to heal, takes the pressure that might have been coming directly on that nerve in the neck off of it, and now they can still have bad posture. Not that we're promoting bad posture or bad ergonomics, but they could go back to the same ergonomics that they had before, because we see this all the time with patients in our office. So they didn't adapt their lifestyle at all. They didn't listen to our advice at all. But they came in and got adjusted, and now their carpal tunnel syndrome went away, and they were able to go about their daily life. So I just wanted to round that out so that you don't feel like you have to live this perfect lifestyle in order to heal and to function well and not have things like carpal tunnel syndrome haunting you.
Totally. And on top of that, it is so important to take rests in between, whether you're like in the car. It's good to, have a stopping point. You're gonna have to go to the restroom at some point anyway, right? Or refill up on gas. Get out, walk around the car and move your body, like not staying stuck in that same static position for too long. Same thing when you're working on your computers or whatever else. I tell people, and I'm like, hey, after an hour, get up, go grab a drink of water. Like, get up, stretch, bring your arms up right, open up your shoulder, do kind of like that sunshine stretch, opening up your muscles, opening up the chest, leaning over to the side so you're elongating the fascial tissues and and not only that, is it's going to allow you to have a refresher when you get back to whatever work you're at. There's so many people that are like, no, just another 30 minutes, just another this, I'm almost there. But you will start to decrease in your efficiency of the work output if you don't pause after an hour. So it's like, no matter what, do it for your brain function and do it for your bodily function. Take a break, get up, move around, stretch, take a drink of water, whatever it is. So all of that said, we've just addressed a lot of the common questions, and as you can see, there's a lot of overlap that's happening. There's so much valuable information that you can utilize. If you yourself are dealing with carpal tunnel syndrome or anything that might seem like it, anybody else, make sure you come and you get a conservative approach and come into Ignite Chiropractic, get checked wherever you're at, get a chiropractic assessment, examination, so you can see what's going on, making sure it's taken care of properly.